I know there's a lot of focus also on genetics, on our predispositions. And sometimes we use that as a crutch sometimes. But I even recently spoke with Dr. Rao, and he mentioned 40% of his American cancer patients, they find a genetic deficiency in detoxification. They simply can't detox. What are your thoughts on the genetic predispositions of detoxification, and how do you work around that?
So I'm glad you brought that up. And I know Dr. Rao has been looking at that for some time. And only recently, like within the past year, have I also been really focusing on the nutritional component the genetic component of this. There is a company that we've been using recently because I feel like their nutrition platform, their genetic platform really explains things in such a clear way. And I'll just mention that what I currently like is called Nutrition Genome, which people can order for themselves, but it's challenging for an individual to interpret it at the level that we need. So definitely there are genetics that absolutely have an influence on not just the detoxification. I mean, yes, the beauty is that it shows us phase 1 and phase 2 liver detoxification through cytochrome P450 genes, and then also like glutathione, peroxidase, acetylation, all the phase 2 liver detox pathways. And so getting the genetics can make a big difference, but also the neurotransmitter genetics is very interesting, specifically like the catecholomethyltransferase, COMT, and the serotonin transport pathways. They literally show how a person is potentially going to be more susceptible to going into fight or flight with the same exact circumstances. And when we've been reviewing these genetics with patients, there's like, when we go through it, they're like, wow, that really is me. How did you know that I've always had IBS? How did you know that I'm so susceptible to anxiety? And it has to do with sometimes people are like this, have slow COMT, so they are more susceptible to building up dopamine, which is then an excitatory neurotransmitter. And then we have to do things to try to help counterbalance that through the things that we would typically be saying, like meditation and exercise. But magnesium is really good for calming this. And lithium orotate can be really useful as a way to ground the nervous system. Yeah.
Yeah, there's so much to be said about our predispositions or, proclivities to certain things, but there's also epigenetics and, how we live our life. What are your recommendations then? You talked a little bit about diet. Let's go into that, maybe start there. Is there a specific detox diet that you're recommending for most people without getting into the personalization of it?
Well, I'll make a shameless plug for the book, which basically has the whole diet laid out, which is basically an elimination diet.
Yeah.
And the elimination diet, I think, is not anything new. It's just how we package it. But essentially, we are trying to temporarily eliminate inflammatory foods, which I say are, depending on what a person's level of inflammation is, we'll temporarily avoid grains, beans, dairy, nightshade vegetables, and basically processed foods. So what do you eat? Lean protein, chicken, fish, turkey, eggs, lots of vegetables, ideally organic if possible. Starchy vegetables are okay as well, like squash, sweet potato, pumpkin. And then if a person is concerned about weight loss, then there are some grains that might be okay, like millet or white rice, potentially. And the whole purpose is basically just taking a temporary modification to what a person's currently doing to allow the body to have a rest so it can refocus its efforts. And sometimes even when we have a patient that's very sick, we may even have them take a temporary fast. And fasting is age-old. It's been around for thousands of years, built into religious holidays. And fasting is not just for spiritual intuition, but it's literally causes the cells in our body to have an opportunity to do its internal detoxification, which is called autophagy.